So I'm delighted now to welcome to the stage Dr. Ryan Punambolam, consultant neurologist from Doctors Hospital, and he's going to present to us on the topic Rewiring Hope, the neuroscience of stress, anxiety, and resilience in Cayman's youth. Help me welcome Dr. Ryan to the stage.
I am completely blown away. What a conference. I promised Miss Lizette next year I'm not speaking so I can relax and listen. But amazing, and the energy at 3 o'clock on a Saturday is, I've never been at a conference like this, so you guys should be tremendously proud. You know, the teenage brain is an amazing thing, far more interesting than the boring adult brain. And when you think about it, it's hardwired to do very, very difficult things. It's meant to be bold and brave. It's meant to take risks and seek out new experiences. And it's hardwired to create strong social bonds. But despite all of this underlying resilience and strength, we all know there's an underlying vulnerability. And we all know this chart. For some reason, in the midst of adolescence, we see an uptick in many, many psychopathologies: anxiety, depression, OCD, eating disorders, even schizophrenia begin to emerge in the midst of adolescence. And we know these numbers. In fact, 75% of all brain disorders are diagnosed by the age of 25. If you have a serious brain disorder, and make no mistake, anxiety, depression, substance abuse are brain disorders, your life is cut down by 25 years. And we know things are getting worse. With each subsequent generation of teenagers, we're seeing rising rates of depression. But the question remains, why? Are teenagers just soft? Are they addicted to their phones? Why do we see this uptick in psychopathology in the midst of adolescence? And before we answer that, we need to understand a little bit more about how the brain develops and how it matures. I want you guys to remember this concept. The brain is very different than any other organ system. So your liver has a linear growth pattern. You ask any parent, any coach, any teacher, our brain doesn't grow like this. It grows in explosions. These explosive growth periods is called the sensitive period. And what a sensitive period is a sweet spot. It's a defined window where the brain is primed to learn something specific. And if we give the brain that input, magic happens. We see explosive growth. Now, as an example, the best studied sensitive period is when babies are between the age of 0 to 2. Their brain is primed to develop their visual cortex. So if we give that baby rich visual inputs, we see explosive growths. Now, unfortunately, we see babies who, for a variety of things, if they have tumors of the visual cortex, if they have congenital cataracts, they don't have that visual input. And even if we correct their vision, say at 3, 4, 5 years old, we do see development of the brain, but it's never as good as that baby where we hit the sweet spot between 0 and 2. Now, it may surprise you that adolescence is also a sensitive period. It's a sweet spot for the brain, but for different reasons. The brain is primed for, guess what? Threat assessment, regulation of your stress system, social connectivity, emotional regulation, assessing risk and reward. If we don't give our teens the right input at the right time, they'll never catch up, and we pass the point of no return. So I want you guys to remember that concept of a sensitive period. We're going to come back to it over and over again. And this is an example of a sensitive period. The reality is, and if you're going to speak to your government, if they want to make a real change, if they want to build better brains on this island, don't worry about gambling. Don't worry about, tourism. worry about eradicating poverty. Poor kids and teens, so poor kids and teens never catch up to rich kids. The reality is, and now we know about the sensitive period, if you're a poor teen, you're deprived of, guess what? High quality education. You're stressed. You're nutritionally deficient. And what happens? You never quite catch up. It doesn't mean you're weak. You might adapt, you might have other strengths, but in certain brain metrics, you never catch up because we missed that sweet spot. So why then do we start to see this psychopathology? Why do we see these issues in the teenage years? And the first time in history, and we're talking within 20 years, with technology, functional neuroimaging, things like fMRI and diffusion tensor imaging, we finally have a window into how the brain is actually functioning and how it's maturing in adolescence. And so before we understand what goes wrong, let's understand what goes right. So when we're talking about brain development, we can talk about two spheres. The first is structure, the nuts and bolts of the brain. The second is function. How does the brain react and act? Obviously, structure and function are intimately bound. One of the most important structural changes that we see in brain development is going to surprise you. You'd figure bigger brains, bigger bodies, you're going to have more cells. There's two types of tissues in the brain, as you guys know. There's gray matter, and then there's white matter. Imagine the brain is a city. The gray matter are the houses. It's the neural cell bodies. Surprisingly, look at this. As our brain develops from 5 to 20, look what happens to the gray matter. The amount of houses, the amount of cells actually goes down. Isn't that weird? Another thing happens in the brain. If you look at this 6-year-old brain, this is a beautiful 6-year-old brain. But remember, our brains are like a city. We just learned that the amount of houses come down as we transition from childhood to adolescence. So look at this 6-year-old brain. Lots of houses, and just like in our city, when there's lots of houses, what comes next? Lots of roads. And there's a crazy amount of roads. There's one-way roads, there's two-way roads, there's roads that are dead ends. What we know is that in biological systems, complexity means inefficiency. This is a beautiful 6-year-old brain, but it's very inefficient. Look what happens at the 14-year-old brain. Remember, we learned that we're going to get less houses. So we see a decrease in the amount of gray matter. And we also see less roads. But look at how the roads are. They're thicker. They're better organized. And so with simplification, we see greater efficiency in the adolescent brain. And the way we do this is quite amazing. There's two mechanisms for how we start to deconstruct and how we simplify the brain. The first is called synaptic pruning, and it's no different to what you guys do in your garden. What the brain does, it learns, remember all those roads? It learns very quickly which roads are useful and which roads are useless. And then it triggers our immune system to destroy the roads that we don't need. The second thing that happens is, again, through experience, it learns which roads need to be built up, which connections need to be built up. And so those roads transition from a 2-lane highway to an 8-lane highway. It gets thicker. And then what the brain does is it wraps it up with this insulating material. It's a fatty substance called myelin. And that's why we call the roads, the connections in the brain, white matter. And there's an important sex difference when we look at myelination of the brain, and it's related to testosterone exposure. Female teens, because they have earlier peaking of the testosterone in puberty, they get completion of their myelination much sooner than teenage boys who have a much later peak in their testosterone level, and so we see later deposition of myelin. So that's an important sex difference between males and females in the timing of that white matter being completed. So you see, what defines the teenage brain is connectivity, and there's power. We just heard it. There's power in connection. We see, although we're seeing less houses, we're seeing a decrease in the gray matter, we see much stronger and robust connections. And so, we know that this is a powerful thing, but there's a problem. Remember, we're building a city. How do we build a city? We don't do it all at once, do we? We start one neighborhood at a time, one subdivision at a time. And so you can imagine, we start here with one subdivision. We build the houses, we put the driveways down, we put the roads down. Then we move on to the next subdivision. You can see that if you're in one of the later subdivisions, you're going to be pretty jealous because this subdivision is well built. They have water, they have lights, they have cars, they have everything. The same thing happens in the brain. The brain develops back to front and deep to superficial. And so you can see there's a timing problem. And the unfortunate thing with biology is that the part that we need the most is the last to develop. There's a part deep in the frontal brain called the prefrontal cortex. And the prefrontal cortex does all the important things in life. It's important for judgment, insight, it helps balance risks, it helps with social connectivity, and it's so critical for emotional regulation. We need this the most, and what this cartoon is showing you is there's lots of moving parts. It's very complex. This part of the brain is so complicated, it takes 30 years to fully develop. The prefrontal cortex is not developed until the age of 30. And this is a problem, because remember we talked about the way we see development, back to front and deep to superficial. There's a bully in the brain, and it's called the limbic system. And the limbic system is very primitive, but it has important functions. It's important for memory. It's important for stress regulation. It has a part of the brain called the amygdala that's the size of an almond, and that's the guard dog of our brain. It's important for threat and fear detection. And we have another part of the brain called the ventral striatum, and that's important for risk, reward, and motivational behavior. This is tightly linked to the dopamine system. And you can see the problem is this bully, this primitive part of the brain that drives threat and drives risk-taking behavior, is much more developed. And so you can see there's a fundamental imbalance, because if you think about it, it's like a soccer team. The prefrontal cortex is like your coach. But look at what happens in the teenage years. Because of this mistiming of development, the limbic system, the players are telling the coach what to do. So we're being driven by threat. We're being driven by these primitive things like risk-taking, reward behaviors. As we transition and we move away and through adolescence, what defines the adult brain is reversal. We start to see the coach is now fully developed, the prefrontal cortex, and that balance is restored. The coach is now telling the players what to do. But you can see in adolescence, there's an intrinsic imbalance. Remember we talked about the sensitive period. We're going to come back to it over and over again. This is an example of priming. So this is an experiment where researchers showed 10-year-olds a gambling task, and they did an fMRI. And not surprisingly, we see activation, albeit a low-level activation, in that risk and reward area of the brain called the ventral striatum. That's expected. Researchers then provided that same gambling task to a 16-year-old, and look what happens to the brain. There's fulminant activation of that primitive ventral striatum. That is somewhat biological because remember, our teenage brains are primed to learn about risk and reward, but this is a little bit of overkill. Those players are calling the shots. That primitive part of the brain is overpowering the prefrontal cortex. And so you can see what really defines the teenage years in terms of brain development is this limbic predominance, this imbalance between the prefrontal cortex that's weaker and that primitive limbic system. And this is not necessarily a bad thing. Imagine if you have a little bit of extra limbic inputs, guess what you're going to be? You're going to be highly motivated. You're getting straight A's. You're making friends. You're playing soccer. You're taking risks. That is very good. That's a positive developmental step for teenagers. That's what they need to do. But the problem lies when we start to see the gap widen. And how does it widen? There's genetic factors and there's environmental factors. Things like stress, trauma, substance abuse, even sleep starts to widen that gap. And remember, we learned about this sensitive period. We only have a window to act. If that widens too much and it doesn't close before that sweet spot closes, that developmental trajectory will never catch up. So this is one of the fundamental theories that helps explain why we start to see an uptick in psychopathologies in the adolescents. And this is a neurodevelopmental framework. So let me give you some examples. So there's one brain here that belongs to Emily. And for some reason, the reward center, the ventral striatum, is not functioning properly. So what we see behaviorally is Emily does not find joy into things that should be joyful. She's losing motivation. She's sleeping more. Her appetite has changed. Based on a checklist, we would say that Emily's depressed, but we're not really addressing what's happening at the level of the brain. Fundamentally, this is an imbalance between the primitive limbic system and the prefrontal cortex that's immature and is not yet correcting that circuit. We have another brain that belongs to Tommy. Now, in Tommy's brain, the amygdala is driving up and overpowering the prefrontal cortex. So how does that manifest? Tommy feels threatened. He is fearful, even to go to school. He's sweaty. He's not eating. He's withdrawn. Based on a checklist, we would diagnose Tommy as having an anxiety disorder. But again, it's not addressing what is actually happening in the brain. There's a fundamental imbalance with that guard dog, that amygdala, driving up that threat behavior, but there's no regulation. There's no top-down regulation from the prefrontal cortex. So we see that the development of the adolescent brain is very complicated. There's lots of moving parts. But how does that saying go? Moving parts get broken. It's a miracle that we see healthy teenage brains transition into young adulthood. Everything needs to work perfectly. If we have a problem with timing or magnitude, meaning if a part develops too early or too late, or too much and too little, we see a widening of this prefrontal limbic imbalance. Does that make sense to you guys? And so this makes sense to the clinicians in the room. Every clinician will tell you that adolescent mood disorders is a different beast than adult mood disorders. It's much more refractory, it's resistant to medications, it tends to relapse, and it's far riskier. Adolescent mood disorders are far more dangerous than adult mood disorders. And perhaps the reason why is because there's a different mechanism. One is driven by this intrinsic neurodevelopmental imbalance. So if it's a different beast, maybe we should approach diagnosing and intervening in a different way. And so how do we begin to start to make this better? How do we start to intervene on this fragile, vulnerable brain during adolescence? The first thing is, remember, we're going to go back to the sensitive period. If there's one slide I want you guys to remember, it's this slide here. This is a study from the New England Journal of Medicine published in 2021 where they randomized public schools in Pennsylvania to conventional screening. What we usually do now is we identify Emily. Emily's acting a little bit funny. She's withdrawn. She sees her guidance counselor. Then she's referred to a psychologist, clinician, psychotherapist, and they're diagnosed with depression. That's what we call targeted screening. But in the intervention group, what they did is universal screening. Every grade 9 to grade 12 student in those public schools were screened for mental illness at the beginning of the year. And what we see is amazing. Universal screening increased the pickup rate of teens at risk by 6 times. We see 3 times as many kids were formally diagnosed with a mental illness, and twice as many kids had early intervention. This is cost effective. We have to stop targeted screening. Every teen on this island needs to be screened for mental illness. That's going to make a tremendous difference. And interestingly, what they found is that female adolescents benefited the most from this universal screening paradigm. The other thing that we have to do better in psychiatry, so I think psychiatry has to borrow from the other medical specialties. And I'll give you an example about breast cancer. So we can learn a lot about breast cancer and apply it to mental illness. So every woman in this room will eventually get screened for breast cancer. Isn't that right? And the age we screen just depends on your genetic risk. Some people are sooner than others, but every woman in this room will eventually get screened for breast cancer. And some of those mammograms will reveal benign shadows that the doctor will follow up on and say, don't worry about it. But some of those women will be diagnosed with aggressive cancer, stage 4. Others will be diagnosed with stage 1 cancer. It's all cancer, but they're markedly different, isn't it? How we approach, how we monitor, and how we treat stage 1 cancer is very different than stage 4 cancer. But we don't do that in psychiatry and psychology, do we? We wait till Emily stops eating, till she drops out of school, until she drops off a cliff before we pay attention. This is a consensus statement published in 2020 that it begins to shift our paradigm, how we approach the diagnosis of mental illness. Mental illness doesn't begin when Emily falls off a cliff. It's beginning with subtle symptoms. She begins to withdraw. She stops participating in her school sports. Her grades start to slip. We need to pay attention when it's stage 1, because if it turns out to be stage 4, it's too late. We have to stop being reactive and being proactive. Again, universal screening and try and listen to the kids when they have subtle early symptoms of mental illness. So what are some practical things we can do, all of us can do, to help our teens and help our teens' brains develop in a healthy manner? A non-negotiable is sleep. If your teen is sleeping less than 7 hours a day of restorative sleep, or their sleep is variable, they're sleeping more on the weekends and less on the weekdays, we put their brain at risk. We know there are structural and functional implications. When a teen is not sleeping enough or they have variable sleep times, we see decreased activation of the prefrontal cortex. That coach is weaker because the teen is not sleeping. We also see structural implications. When the teen, again, is not sleeping enough or there's variability, remember those white matter tracts, the myelin that insulates the wires? In the frontal white matter, we see decreased integrity. We see injury to that myelin. And we need speed in the frontal cortex, don't we? So when we take away sleep from our teens, we're making the coach weaker and slower, and that's a bad combination. So sleep is non-negotiable. The other issue, and I chose this because it's a timely thing, one thing that is absolutely certain, cannabis is not safe for teenage brains. If you guys are interested, this is a review from New England Journal in 2014. There was a study that was just published, the largest study yesterday. It was 400,000 teens, and they looked at the relationship of cannabis use and the risk of psychopathology. It confirms what we already know. A couple of things we know from the New England Journal article. The cannabis being smoked now is not the cannabis our parents smoked in the 1970s. It's true. This is an older study, but from 1995 to 2012, the potency of THC doubled. And that was 14 years ago. What is right now being smoked is a completely different beast. And we see the implications. When we look at, this is an American study, with increasing access to high-potency cannabis, the emergency room visits are almost similar to cocaine. Cannabis is not safe. The other thing we see from multiple meta-analyses is that an adolescent brain, especially when exposed to cannabis in the sensitive period to high-potency THC, we see a 3 to 4 times risk of psychosis. This is not benign. And that's what the JAM article that was published yesterday again proved, that it does increase particularly psychosis in adolescents. And we see when we look at fMRI data that it has real biological impacts in the brain. Not surprisingly, in teens exposed to THC, we see upregulation, we see increased activation of that ventral striatum, that risk-taking part of the brain. So again, it'll begin to drive increasing risky behaviors. Hence, that's where we see the emergency room visits. The other thing that I want you guys to take home, and it speaks to what we've heard already today, it's a UCLA study where they randomized depressed teenage girls to either conventional treatment or they paired their mom in a group therapist, an educational kind of session. And what they taught the mom and the daughter is something called emotional labeling. What this means is tonight when your daughter comes into the house and slams the door and runs to her room, don't run up on her and start yelling at her. Pause and say, Emily, what's wrong? How are you feeling? Are you angry? Are you frustrated? Are you overwhelmed? Are you tired? And that seems kind of airy-fairy, but I can tell you this is a powerful neuromodulatory technique. What we know with this emotional labeling, and now you guys know the physiology, what are we doing? We're pulling the emotion, we're pulling the power from that guard dog, the amygdala, that's driving up fear, that's driving up threat, and we're pulling it up to the prefrontal cortex. We're giving power to the coach. And if we do that repeatedly, remember, the brain is like a muscle. What happens? We start to see the coach get stronger. And that's exactly what we see when we do pre and post fMRI studies. Compared to the control group, the mom and teens who practiced this emotional labeling, we see upregulation of the prefrontal cortex, and we see downregulation of that bully, that amygdala. So emotional labeling is an important and powerful tool, and it's one of the reasons why things like journaling and cognitive behavioral therapy actually works, because it's actually impacting the function of the brain. I'm not going to talk a lot about SSRIs and cognitive behavioral therapies. You guys know all about that. But one take-home message, remember, we're not talking about chemicals here. We're talking about neural networks. We're talking about broad, very complex systems. And what we know is that SSRIs, when we expose teens to that, we see downregulation of the limbic system, and we see upregulation of the prefrontal cortex. And obviously, it's even stronger when it's combined with cognitive behavioral therapy. But you guys know the problem, right? 50% of teens do not respond to first-line therapy when diagnosed with major depression. So what do we do? How do we rescue these teens? Fortunately, over the last 10 years, there's been dramatic changes, strategies in terms of direct neuromodulation. And there's one technique, perhaps the widest used technique, it's called transcranial magnetic stimulation. And what we do is we apply a magnetic field. This is as strong as an MRI, almost 1.5 to 3 Tesla, but over a specific period of the portion of the brain called the left prefrontal cortex. And we administer pulses. Those pulses descend into the brain, and they induce a current. And that current, in turn, causes widespread activation of that prefrontal network. This is such a benign therapy. The only side effect is tingling of the scalp and a headache that goes away with Tylenol. Far safer than SSRIs. And the largest study was published in November 2025. This is now FDA approved for teens as young as 15, based on the results that we see. And remember, these are the treatment resistant. These are the 50% that have failed first-line therapy. We see a two-thirds of teens exposed to TMS have a 50% reduction in their clinical depression scores. And you see post-TMS, what happens? When we activate the prefrontal cortex, when we modulate the prefrontal cortex, we see increased activation. That coach gets stronger. And then we see top-down regulation. That limbic system begins to settle down. So what we do is we start to narrow that prefrontal limbic gap. And so in summary, what do we learn? We learn that adolescence is not simply a transition period from childhood to adulthood. It represents a distinct neurodevelopmental period. We learn that it's primed. There's a sensitive period where this brain is primed to learn about emotion, regulating stress, understanding risk and reward, and for social connectivity. We learn that intrinsic to the way the brain develops, we see this imbalance between that bully, that limbic system, and the prefrontal cortex that lags behind. We learn that that gap can be widened through genetic factors, but also environmental factors, things like poor sleep, substance abuse, toxic stress will all widen that gap. And when that gap widens and extends beyond the sensitive period, that teenage brain will never catch up in terms of the developmental trajectory. Our job is to capture these teens quickly using universal screening. We're going to pay attention to more subtle symptoms. We're not going to wait till the teen falls off a cliff. We're going to pay attention. We're going to intervene. And how do we intervene? Sleep. We're going to not allow them access to toxic substances. And we're going to employ things like emotional labeling. We know the problems with first-line therapy, and I'm proud to say we will have access to TMS in the Cayman Islands in the second quarter of 2026. And so that's it.